Actually, bago ako rito. So, I'm basically cramming. As I discussed kanina, my office is the anti-drug abuse of Caloocan. So, at the same time, when the drug war started, bago din lahat, di ba? So, naisip ni Mayor, ito, hanap tayo ng taong mukhang sanay sa mga bagong problema, and he threw me to the mix. So this is where Elmer and I actually met, sa aming advocacy, no, sa community-based drug rehab, because that was the innovation that we introduced to the whole country. Actually, we realized that that the usual way of fighting the drug war was not working. So we had to come up with something. So I'm put in charge of contact tracing, and I realized that parang late na tayo dumating sa game, no? When we should have done this, we should have done contact tracing when we were in ECQ, when the whole country was almost the whole country was in lockdown. So that was the time to really train and everything. But obviously, I don't know, it's something with our nature that we, nung nag-lockdown, parang nag-shutdown din tayo. No? I think si Elmer na lang nagtatrabaho nun. Everyone was basically hibernating. So we had to start basically when, we had to look for the frameworks. You know, what were the legal frameworks that were available to us the whole time, and we found that in 2018, Congress actually passed the law, no, yung RA 11233, which is the law on reporting of mandatory reporting of notifiable diseases, right? So that became our framework, so to speak, because at that time we had a epidemiologist. We had who's still basically waiting for a formal confirmation of her office, and the CESUS and MESUS in almost the entire country basically inassume na lang ng DOH that they were existing. No, but we had no clear map on, you know, who are the good ones, because they were supposed to be the ones trained to lead us in this war. No, kung parang kung gera ito sa COVID, so sinong sanay dito sa ganito, you promote that guy, he becomes the field general, someone in the mold of Patton or maybe Rommel in the side, no? So naging specialist sila. So what the mayor did was to set up a COVID command center, right? And I'm gonna share a screen. Is this my screen? Yes. Can you see everyone see this? So this was the file I showed last time we talked, but this one I sort of improved. So before we started, the first column, the boxes on the first column, kalat-kalat yan. So there were test results coming from our partner hospitals. We have two hospitals, the Medical Center South and North. And then our main partner, of course, in testing for COVID is the Philippine Red Cross. We have other partner testing centers like San Lazaro and Chinese General. And we paid for these, for the swabs. No? Then the other box will be the testing centers who do not have MOAs with, something like maybe Makati Med, or some others get tested in other testing centers, and those results appear in the group chat or maybe in the mail of our CESU, our epidemiologist. And then the last box will contain all the other test results. Yung mga nagpapatest, kanyang barangay, etc. And they didn't tell us that they got tested. So these are generated from the ground. Right. So what we did was to set up a capture system. We corral all the test results. So all the test results before you get tested, you have to fill up a form, which is the case investigation form. That contains your name, your number, your address, person you got in contact with, why you're getting tested, most other details. So it's a form in the last DOH memorandum on this matter now about COVID. So that's the first form that we obviously have to digitize. And until now, when you go to a testing center like PRC, there's no laptop there. Or the forms are filled up by hand, right? So that's the first problem, because when you fill up a form by hand, you're gonna lose a number, you're gonna lose a name, or a letter. Then the number becomes uncontactable, and there goes your problem. If the case becomes positive, if the index patient becomes positive, how do you get in touch with that index patient? So our job here in the command center is to call all these index patients, the positive cases, and we come up with another form, which is the contact tracing form. Okay, so this is the form that contains all the close contacts that the index patient had for the past 7 days. Okay, so iba-iba yan. In the DOH estimation, it's 2 days prior to onset of symptoms, prior to testing. We said that the definite date is when you got tested. That's a definite date. So we go back, we work back 7 days, and we trace your movements. We sort of form an activity map on where you went to, who you talked to, how you got there, and more importantly, who you talked to in more than 5 minutes without or at least 5 minutes without a mask on. That automatically becomes a close contact. So you guys know these things. So the contact tracing form now becomes an actionable document, okay? And that becomes a line list. It's not here yet. The other form that it will become, once the contacts are identified, the close contacts are identified, they are now transmitted to the BERTs. Okay, so the BERTs locate those close contacts, and then they tell them to stay put. And they have to monitor. This is the most important function of the BERT. They have to monitor. If the close contact becomes symptomatic, then automatic magiging, he becomes the priority in testing. Then after testing, they have to be quarantined. No one can leave the quarantine area until the test results come out, okay? So, and then they have to monitor their daily progress. Then the work goes on to the CESU, who back to command center, because the CESU holds office in the command center, and she analyzes the data and comes up with a daily report on incidents. How many close contacts have we identified? How many have we talked to? How many have been swabbed? All these numbers are inputted to a central database. And then the CIF now is uploaded into the COVID Kaya, and COVID Kaya has a sort of a dashboard that shows where most of the infected people are. So, and then the list goes on to the City Health Office, who will every day come up with a new people to be tested based on the report of the BERT and the report of the health centers and the report of the command center. So these three forces now working together and very carefully interacting with each other. The whole point is to identify the close contacts and find who are symptomatic so they can be tested, right? So we're very careful in layering the job, because BERTs, before the trainings that we conducted, I personally conducted trainings together with our CESU starting last Saturday. No, so I think we talked last Thursday or Friday. Starting Saturday, we had a whole day orientation with our core group in the command center. Then we expanded to the health centers, where we retrained the nurses in the health centers, and then trained the dentists, who are now utilizing to become contact tracers. So we're telling the birds, your job is not to identify these close contacts. That's our job. But your job is to locate them and to tell them to stay put and to monitor them. So mas naging simple, no? Dati kasi hilong-hilo yung bird anong trabaho niya. So I guess we our training ended yesterday, and I emphasized again the need to what we did was we came up with a simple Google Forms, no, so that the names are generated. It's more easily extractable. It's also tractable, and at the same time, we can have a tracker, a client tracker. Who did we call? Where did the call go? What happened to the call if it was dropped, etc. So the whole system is now at least set up so that if it works, then we'll have a lot of digitized forms now in our hands, and that will make the job of the CESU and hopefully with the DOH easier. So looking at the COVID Kaya, and I've been being oriented, and that's actually I think the push. And it's a dashboard it's a bird's eye view, of what's happening in terms of which areas are gaining in numbers COVID wise, and also but there are also other texts out there. For instance, the GIS of General Magalong or Mayor Magalong, sorry. Is I think reliant on a sort of a military system where you have to, for every person to be locatable, he has to report his longitude, latitude, right? And that becomes sort of problematic on our part because not every person, well, even if we teach it to people, even if we teach it to people, not all of them have cell phones who can generate that longitude latitude. Then you have to capture that. Then you have to send that. You have to send that screen capture to the COVID command center. Then we have to encode it in the center. Make sure that we encode exactly the exact numbers in the longitude latitude. So I realized that that takes a lot of work. What we saw what was needed was actually some sort of a locator. So I was intrigued by the platform of Pay because the moment the person gets into that system, then he can be located via the search box, right? I realized something like a Singapore or a Taiwan, which has high penetration of cell phones and smartphones, could easily utilize something like Bluetooth, etc. So if I may share, Elmer. So actually, we came into this sort of a tech. It's a band. It's right here, right? So the band contains a QR code, and using a smartphone or an Android, I can tap the Android. I can tap the QR code. I can scan it, and basically the Android will show the phone. Sorry. It's taking quite a while. So if I have a video actually, yeah, see. So the phone will show where I've been, the past several days, and it shows my current location. It will also show where I've been. So if you just open the locator band, etc. So plus the other feature is I can just input the number in that tag, and then input it in the computer, and the screen will show where I was last scanned, right? So it's not a real-time scanning because obviously it's a QR, doesn't generate a signal, but with enough scanners or with enough smartphones scanning that band, you can more or less locate. So it's very useful to us. It happened because few days ago, several of our employees did not inform us that they have been tested, they had been swabbed, right? And then before the results of the swabbing came out, they reported to work, right? And then after they reported to work, only then did they find out that they tested positive yung result, right? So nagkagulo yung opisina namin. So like, how come that person did not stay in quarantine after testing? You have to wait for their test results. Same with the PNP actually. They have this protocol, and they mean well, obviously, you know, have this protocol that, okay, you get swabbed, and then 4 days later, with or without results, you go back to work. What if you were actually positive, right? So that becomes a big problem. We have to have a system where everyone who gets tested has to stay put in a quarantine. Wait for your test results before you can leave your quarantine, right? And right now, if you just rely on the not everyone has that discipline, right? They get so. We thought that using a monitoring device like this would help us, no? So that the person now in a quarantine area will get to tap maybe every 2 or 3 hours and say, I'm still here, I'm still here. So sort of a geofenced. But voluntarily, you know, he signs a consent form that he will use that and he will not remove it while during his quarantine. And after you get your test results, then that's the time that the scanner will show it's green. Or if it's red, so you cannot go anywhere. If it's green, then ibig sabihin your test results came out negative, so you can move around. So it now you can still tap it if you go into Starbucks, for instance. Starbucks will show who you are, etc. It will basically be functioning the same function as the pen and paper that we're doing now in Almost Or. So we discussed this in the team and the mayor, and they said, you know, I think we could have a pilot or a system and how people will react if their human rights are being violated, if they feel that their privacy is being violated. But I think the easiest way to turn this around is just to have them sign a consent form. So if you have enough monitors going around, more or less, if that person, you have a sort of level of comfort, you know, that the community is not being infected. The person who should be quarantined are being quarantined, you know, etc. So that's helpful to us. And hopefully, if we can now generate more questions, more scientific queries, and because if we just look at data, data is basically just there, no, for analysis. It doesn't present solutions, right? So, but we have to think of questions. We have to think of models, no, causal models, for instance. I've just started reading Julia Pearl's book, The Book of Why. You know, parang totoo naman. If you don't have a question to pose, what would the data tell you, right? So you have to have that frame of mind. But we don't know what questions to ask as of now. So I guess if we have more of the data on the movements of people and the characteristics of people and maybe even the birthdays, etc., then we can ask more questions on how we can actually, you know, beat this COVID-19. Thank you very much.